was provided to me in my area of expertise and focus.
And you didn't ask, correct? You didn't ask to review?
I did not.
So once you get this well, we can take a break here.
All right, thank you. Ladies and gentlemen, let us take the mid-morning break. Of course, please remember all the admonishments. We'll be in recess until 40 minutes after the hour. That's approximately 15 minutes from now. Thank you. Dr. Waldman? Murray's case, the defendant is present with his counsel as before. The people by their counsel as before. The witness, Dr. Waldman, is on the witness stand. All the jurors and the alternates are present as before as well. To everybody, good morning again. To the jurors, good morning. Dr. Waldman, good morning, sir.
Good morning.
Do you
again.
acknowledge, sir, you're still under oath and still sworn to tell the truth?
Yes, sir.
Thank you. This would be a resumption of cross-examination. Mr. Waldman.
Thank you, Your Honor.
Thank you.
Doctor, you said on questioning by Mr. Chernoff that even when patients come to you voluntarily, that they frequently embellish and or minimize their drug usage, correct?
Yes.
And again, that's a reason why you need to do your own independent, in-depth physical examination and review of the materials so you can make your own determination as to the proper treatment plan, correct?
That's too broad for me to answer. I don't know what material is.
I'm sorry?
What do you mean by material?
What do I mean by
You
material?
said material. It's your word.
Do you know what material means?
I do.
Okay.
I'm wearing material. But you need to give me a better idea. That was too broad for me to give you a specific answer.
Okay, how do you want me to narrow the question? So,
It's your question, sir.
okay. I'll start over.
Thank you.
Okay. People often embellish or minimize their drug usage, even when they come to you voluntarily, correct?
Correct.
Those were your words.
Correct.
Okay. So there's no question pending, okay? And so you want to explain that?
I want to extrapolate on that for you, if I may.
Now it's real clear to you and you want to extrapolate?
No, I stopped you in the middle because I liked what you said and I want to extrapolate on those exact words. Embellish, undervalue, misrepresent. They tell me what they're using, always, but they don't tell me the precise amounts. That's what I meant by my statement to Mr. Chernoff.
How long have you been doing this?
23 years.
And in every single one, your word is always, they tell you exactly what drug they're using.
That's your word, not my word.
No, your word was always.
They tell me the drugs that they used.
Always.
Most of the time, because what you have to understand, sir, is care is voluntary. In addition, when a doctor and a patient meet, they develop, through the interview, through the conversation, a therapeutic relationship.
And I'll talk about doctor-patient relationship, but is it always or most of the time now?
Most of the time, almost always, pretty much every time, if you're a good interviewer and ask the right questions and know the names of all the drugs, you get all the information.
Always, most of the time, some of the time. Is that your answer?
Those are your words.
No, I'm asking you.
What would the objection if you had the last answer?
I'm asking you.
Ask a specific question and I'll give you a specific answer.
Is it always, most of the time, and some of the time? Is that your answer?
In my extensive experience, in my interviewing, I get the answers almost all of the time.
Okay, so almost all of the time.
Correct.
Not always.
Almost all of the time.
Now, where do you work as an addiction specialist?
I work at I work in my office, first and foremost, and I've worked at hospital-based facilities. I was co-director of a hospital-based facility for a period of time.
Where do you currently work as an addiction specialist?
Keeps interrupting my answers. My answer again is, in the past, I've worked at hospital-based facilities. I'm giving you the broad spectrum.
Sir, Mr. Chernoff can ask you questions as well. I'm asking you, where do you currently work as an addiction specialist?
My office and a number of primary treatment facilities that are confidential.
That are confidential?
Correct.
Did you tell Mr. Chernoff these confidential locations?
I did not.
Why are they confidential?
The clients there are confidential. The facilities would like to remain confidential, and so I'm respecting that.
Well, I'm not asking about any patients or client names or anything of that nature. I'm trying to flesh out your experience, and I'd like to know where you currently work as an addiction specialist other than your own office.
Okay. Is it okay to answer?
Absolutely.
Okay. I work at Visions Adolescent Treatment Facility. I work at Clearview Treatment Facility. I work at Authentic Recovery Center. I work at Canyons at Peace Park. I work at Cliffside Malibu. And I work in my office.
And where do you spend most of your time as an addiction specialist?
All of the above.
And you're a consultant, or are you actually giving person-to-person care, or how do you work at all those various locations?
Both. I consult and I see patients there.
At all the places you see patients?
That's correct.
And you also do the dialysis work?
I do.
Is that full-time?
What do you mean by full-time?
Well, it typically means 40 hours a week, something like that.
I wish I worked 40 hours a week, and so does my family.
So the question's still out there. Do you work?
I work a great deal of hours every week.
Okay, how many hours do you work in dialysis?
You know, I'm not being glib, but the real answer is I see every patient every week, and I work as long as I need to. It's variable. Sometimes it's many, many hours. Sometimes it's less hours.
Approximately how many hours a week do you work in dialysis?
I don't know. I couldn't quantify that, sir. I don't keep track of that.
You can't give me a range?
I really can't. I honestly, I don't count them. I don't track them.
Is there a reason why it's so difficult for you to answer my questions and it was so easy for you to answer Mr. Chernoff's?
Objection argument is
Sustained. You need not respond. Your next question, Mr. Walt?
You can't answer how many hours you work in dialysis. Is that correct?
What you're asking me is extremely nonspecific, and I'm telling you honestly, I don't measure.
How many hours did you work in dialysis last week?
I don't know.
I was specific.
I was at the dialysis unit Monday morning and afternoon, Tuesday for a few hours, Friday for a few hours. That's my typical week. Sometimes I go on Thursdays, sometimes I don't. Sometimes I go on Tuesdays, sometimes I don't.
Would you agree that in the field of addiction medicine, that it needs to be confronted as a real clinical disease with very real clinical roots?
It's absolutely a brain disease, and it needs to be treated as such.
And that's one of the reasons why, to competently handle it, you should have experience to handle it, correct?
I believe you're exactly correct. Experience is really important.
And from the Cliffside Malibu website, where your picture is posted, it states, as is true of any disease, addiction can only be overcome with intensive medical specialized care.
Which is provided at Cliffside Malibu, not by Dr. Waldman all the time.
But you agree with that assessment?
I think it's a great assessment.
And you, of course, in your experience, have had patients come to you that had previously received subpar or incompetent addiction care, and then came to you and you were able to help them, correct?
Your words, sir, not mine.
I'm sorry, are you going to?
I have no answer. I think I never made such statement.
I didn't ask you if you made that statement. I'm asking you a question.
No, you're actually putting the words in my mouth. Would you
Your Honor, would the court instruct the witness to answer the question?
Thank you. Cross-examination is, in essence, putting words in your mouth which you can either accept or reject.
I reject.
Okay.
So you have never had a patient come to you that you determined had received incompetent care and you were subsequently able to help them. You've never had that happen?
Sir, I never embellish what I do by denigrating what one of my colleagues does. Addiction treatment, casting dispersion at prior treatment, it's not necessary. When somebody comes to me for treatment, many times they've had prior treatment. Their success or failure of treatment is not a function of who treated them. It's a serious illness. Failure rate is twice the success rate everywhere.
So now, it's not a function of who treated them. That plays no role?
What I said to you in answer to your question again, sir, is that when I accept somebody in treatment, I don't speak negatively about their prior treatment.
I didn't ask you to.
Yes, you did, or the treatment providers.
Okay. Mr. Waldman, have you ever had Dr. Waldman, have you ever had someone come to you and you've had an opportunity to review their prior care? Have you ever had that happen?
What do you mean by review their prior care?
However you want to interpret it.
You're asking the question, sir. If you ask me a specific
Your Honor, will the
question.
court instruct the witness to answer the very simple question?
Are you able to, or do you want it re-asked?
I would like it re-asked, please.
Mr. Waldman?
Have you ever, by any means, whatever you want to put into your answer, have you ever had a patient come to you where you evaluated, by whatever means you want to say, Dr. Waldman, where you've evaluated their prior care as it relates to addiction medicine?
Yes.
Okay. And have you ever had a situation where you did such an evaluation and determined that they did not receive proper care as it relates to addiction medicine?
Yes.
There. Thank you. And when you've had those situations where you determined they had not received proper care as it relates to addiction medicine, have you, as a specialist, been able to help them?
Sometimes, I'm sure I have.
Thank you. And one of the reasons for that is because you have decades of experience in this field, correct?
23 years and more than 25,000 hours.
Is that correct?
Yes.
Thank you. Now, you've described, or at least on the website at Cliffside, it describes the care involving two stages, both physical and psychological. Would you agree with that?
I have not looked at what Cliffside Malibu represents on their website. That's their website, not my website.
Could I have the question read back to the witness, Your Honor?
Mrs. Theodoro, please.
Now, you have described, or at least on the website at Cliffside, it describes the care involving two stages, both physical and psychological. Would you agree with that?
Repeat that again, please.
Do you agree there's two stages of proper addictions medicine care involving both physical and psychological?
Sir, I don't look at it that way, no. I think
How do you look at it?
It's care of someone with addictive disease requires a team approach. It's multifactorial. It requires a good doctor, a good medical doctor. It requires a good psychiatrist. It requires a good therapist. It requires family support. It requires education to the patient and the family. It involves, as I said at the beginning of my testimony, it involves AA and 12-step meetings. It involves group and single therapy, one-on-one sessions, and so I don't look at it as two stages. If you would like to look at detox as stage one, I mean, someone might portray it thusly, but that's not my approach.
Okay, and so it's actually, there's far more than two stages. Let me be clear if I got everything. So proper addiction medicine care involves a team approach with multifactoid, was that what you said?
Factorial.
Team approach, multifactorial, a good doctor, a good psychologist,
a good psychiatrist,
a good therapist, education, AA meetings, 12-step program, group and individual therapy. Did I miss anything?
I think that was a good summary, sir.